So, as we're thinking about the right to health, I'd like for you to take some time to think through what the right to health means, what that right to the highest attainable standard of health means during a global pandemic. We've addressed this in a few different ways over time since we've broken for online instruction, and even before that in the lecture that I delivered on COVID-19 back when we were still in session in Boston, in terms of how the pandemic is likely to and since has had different impacts on populations that may already be vulnerable in various ways, in terms of a bioethical argument for how to allocate scarce medical resources when we don't have enough ICU beds or ventilators to go around, and so forth. And so I'd like for you to kind of think through this a little bit more fully in terms of like what our ethical obligation to pandemic response is in light of the right to health. To prepare for this, if we were meeting in class, I actually would have distributed at this point in time an article for you to read for in-class discussion. So I've uploaded that article to Blackboard for you now. And I'd like for you to have read it before you continue on with this lecture. And so if you haven't read it yet, go ahead and stop the video, go read the article on the COVID-19 response from Jim Young Kim, and then come back to the rest of the video. Now that you're back, I do want to just frame briefly who Jim Young Kim is. So Jim Young Kim, who is the author of the article that I've assigned for this in-class reading, was the co-founder of Partners in Health. He is a former president of Dartmouth College. He's also the former president of the World Bank, who just stepped down last year. And he's currently a special advisor to Governor Charlie Baker, who's working to implement a more aggressive strategy to combat COVID-19 in Massachusetts and really trying to help Massachusetts hopefully be a model for the rest of the nation in terms of how to have a more effective COVID-19 response. I bring this up not to argue from authority, but because he's a really important figure in global health who I feel like often doesn't get the level of recognition that he deserves, and because I want to underscore that this is not an editorial that was written by someone who might not be particularly informed about the difficulty and some of the logistics of the steps that he proposes, but he's someone who has serious credentials and experience to back up the claims and the arguments that he makes. So he argues that we need a 5-part program for COVID-19 response, and we are seeing all 5 of these elements implemented to various degrees in various settings, and he's saying that we need to explicitly double down and carry them through. Those are social distancing, contact tracing, testing, isolation, and treatment. I have several students that are involved in contact tracing at the moment and other people that I know in Massachusetts. Massachusetts is really leading the nation in terms of implementing widespread contact tracing to reach out to people that may have been exposed through a contact who has subsequently tested positive, to be advised about their own risk both for developing symptoms and for transmitting the disease to others. We've also in Massachusetts ramped up our testing over the past few weeks. Around the time when we switched to online instruction, I was really dismayed that Massachusetts' testing rate was lower than a number of other states across the country, but it's since increased significantly so that we are able to test a much larger proportion of people than we had been a month ago. And we're still working on effective treatments nationally, as well as in Massachusetts. But Jim Young Kim's argument is that we really have to commit to these steps, to carry these steps through. And the necessity of doing so outweighs arguments to, as it's often called, reopen the economy. He also argues that people will get on board with this approach. And in the article that you read, he writes, "We've been told that many Americans won't put up with quarantine and isolation. But the truth is that most people, once they learn they've been exposed to the virus and may get sick in the near future, understand why they need to stay home. What's required is support. You can't stay at home if you don't have any food. You can't answer a call from a contact tracer if you have no minutes left on your phone or no phone at all. You might need help explaining what's happening to your boss. You'll need reassurance that you'll be able to support your family. The countries in Asia that have succeeded in fighting the virus have provided just this kind of support. Helping people who are infected or at risk of infection stay home or at a designated facility requires money and staff. But there are many Americans who would leap at the opportunity to help their neighbors and their country. And compared with the stimulus package that we have passed and continue to contemplate, the cost of hiring them is a bargain. He's making here an ethical argument about the obligations of a government to its citizens to provide us with the means that we need in order to take those steps to protect public health and prevent the continued spread of this infectious disease. He argues that our country was woefully unprepared for an epidemic like this. We didn't have enough masks to protect our healthcare workers or enough testing kits. The truth is that we hadn't invested enough in our public health system. Our national leaders have passed a critically important $2 trillion stimulus bill. But this is a public health crisis fundamentally. And the only way to avoid more trillion-dollar packages is to infuse cash directly into the fight against the virus. We need to align government spending with measures that will actually help to end the pandemic. We have to open the pocketbook of the United States Treasury and spend whatever we need to in order to put a proper public health response in place at once. The cost of such an effort, perhaps hundreds of billions of dollars nationally, is small compared with the cost of hunkering down, waiting, and hoping for a miracle to happen. I've also assigned for today's class session a short video that was produced by The Guardian UK about New York City transit workers. And one of the transit workers in the film is actually a neighbor of a very close friend of mine. The transit workers are speaking out about the risks that they've been exposed to. As of April 18th, more than 2,496 New York City transit workers have tested positive for COVID-19. 68 of them have died. And in this process, they have been continued to be asked to go to work under what are unsafe conditions that put themselves at risk, with crowded trains because of the continued need to move essential workers across the city. And the workers are arguing that our labor is essential, but our health is negotiable and our lives are expendable. Again, I'd like for you to think through what ethical obligations governments, institutions, and systems have to respect that right to the highest attainable standard of health during a time of a global crisis, and what we can do on a big scale, not just a small one, to make sure that that right is respected.